The current opioid epidemic started really around 2000 in parallel with a significant increase in the prescription of opioids. And this came about because of the desire of the healthcare system to take care of patients with pain, so it was felt that they were undertreated. The problem was there was an over-reliance of the use of opioids to address the need of patients with pain. And so as a result of that, we quadrupled or quintupled the number of opioid prescriptions, as well as the amount of doses that were given to a given patient. So in 2011, there were 230 million prescriptions in 1 year in the United States, which is a massive amount of opioids. And it was believed that if you had pain, that you would not become addicted to your pain medications, which leads doctors to then become very complacent and overprescribe. As they overprescribe these medications, which also are highly rewarding, they were diverted for their rewarding effects, and people started to become addicted to them, and they were favoring them because of the belief that there were medications they wouldn't get addicted. And also we started to see that patients that had pain themselves were becoming addicted to their opioid medications. So as people became addicted to their opioid medications and the healthcare system realized that our practices were actually sustaining the opioid crisis, there was a very aggressive move towards decreasing the amount of opioids prescribed, the number of patients that were prescribed, and then it became harder to get access to these opioid medications. And patients who had become addicted to them then started to shift towards heroin. And heroin, also beginning at the 2000, started the amount of heroin coming into our country started to go up, the purity started to go up, the prices started to go down. So as heroin became cheaper and easier to get than opioid prescriptions, patients started to use heroin. And then around 2013, 2014, the market of drugs actually started to realize that the synthetic opioids provided much greater profit than heroin. So in 2013, we started to see a massive increase of heroin that came into our country laced with fentanyl, as well as other opioid prescriptions from the black market laced with fentanyl and analogs, and fentanyl started to appear in other drugs like cocaine. So it's a very, very potent drug, and as a result of that, the risk for overdoses are very, very high. And because you don't have to grow it, you just synthesize it, it actually provides much greater profit for the black market. And that's where we went from the opioid crisis starting with opioid prescription to shifting to heroin, and now we're facing a massive amount of overdoses driven just by the synthetic opioids.